Molly is confirmed to be 3 weeks pregnant. She is doing well at home until she notices and screams, "I'm pregnant! Why am I menstruating?" Have you or someone you know experienced light bleeding in their first trimester of pregnancy? Don't worry, they are not menstruating. Menstruation should always be halted during a pregnancy, even if an expectant mother has a history of abnormal menstrual cycles. This is because the role of the menstrual cycle, usually 28 days, is to stimulate the inner lining of the uterus to thicken for a potential pregnancy using estrogen and progesterone hormones. Beginning at the follicular phase, the thickened inner lining of the uterus sheds through the period when pregnancy is absent, signaled by low levels of progesterone and estrogen hormones. Next, the ovulatory phase causes estrogen to decrease while progesterone increases after ovulation at day 14. Inner uterine lining continues to thicken, signaled by progesterone and estrogen as the egg travels down the fallopian tube into the uterus body for fertilization. Lastly, the luteal phase starts around day 15. When the egg is fertilized, a pregnancy will occur. The ruptured follicles of the egg will form a corpus luteum of pregnancy, secreting estrogen and progesterone to thicken inner uterine lining, preparing for an implantation. When pregnancy is absent, the inner uterine lining will shed and dispel through menstruation or period. So, why are pregnant women bleeding in their first trimester of pregnancy? The answer is light bleeding. Some common causes include: first, implantation bleeding that occurs in the first 6 to 12 days after you conceive as the fertilized embryo is implanted to the uterus lining. Second, changes in cervix. During pregnancy, there is an increased blood flow to the cervix, so direct contact with it can induce bleeding. Third, any infection of the cervix, vagina, or a sexually transmitted disease will induce bleeding. Fourth, ectopic pregnancy, when a fertilized egg implants outside of the body of the uterus, commonly in the fallopian tube, eventually causing it to burst. Fifth, light bleeding is an early sign of miscarriage, common in the first 12 weeks of pregnancy. Sixth, molar pregnancy, referring to abnormal tissue growth inside the uterus instead of an embryo. Now that we understand the consequences and signs of light bleeding in early pregnancy, the next time that you or someone you know experience it, please consult the family doctor or the obstetrician about it. Thanks for watching. Happy pregnancy.